Knock, knock, knock. Hi, my name is Peyton Walke. I am a nursing student. Is it okay if I take a quick assessment on you today? Okay, can I verify your name and your date of birth, please? Okay. And do you know where you are at right now? And why did you come to the hospital? Okay, and what is the month right now? Okay. I'm going to start off by assessing his eyes. I'm going to check for dilation of the pupil and contradiction, and then dilation and contradiction. And if you can just follow my pen with your eyes, I'm going to check for accommodation. Okay, and the pupils seem to be within Perla. I'm going to move down to his ears. I'm going to check the outside of the ear, check for any skin breakdown, check the tragus and assess for any pain, and check the tympanic membrane. And I would do the same on the other side. I'm going to move to his mouth, assess his lips, which seem pink and moist. Check the tongue, which also is pink and moist, as well as the uvula, which is pink and moist. And his teeth all seem to be within good limits. I'm going to assess the skin really quick. Okay. And I'm going to ask him if he's had any trouble swallowing or any mouth pain or dental pain or any headaches or vision or eye problems or ear problems. We'll move down to his chest. And I'm going to gently palpate the chest and just ask him to pronounce 99 as I go down. Okay. And then I'm going to assess or auscultate his lungs and ask him to breathe heavily each time I go. Okay, and while I'm here, I'm also going to take his heart. I'm going to start on the right side at the aortic, which is at the second intercostal space. And move on to the pulmatic, which is at the second intercostal on the left. Drop down to the third intercostal space, which is the Erb's point. Fourth intercostal space is your tricuspid. And the fifth intercostal space is the mitral, which is where I would assess for an apical pulse for up to a minute. And then I could ask him if he's had any issues with coughing or shortness of breath or any chest congestion or pain. And then I will drop down to his abdomen, which I will start with auscultation here in the 4 quadrants. Okay, and then gently palpate that area. Okay, and I would also assess his lungs posteriorly, which is what I forgot to say. Check for any skin breakdown really quick. And then move down to his arms. Check for any breakdown or lesions. And while I'm here, I'll ask him if he can push against me and then pull and check his capillary refill. It should be less than 3 seconds on both sides on the arms. Move down the leg check the genitalia, check for any breakdown, redness or discharge or any discoloration. Check for any breakdown on the legs. Move down here and do my dorsal pulses and my tibial. And check for capillary refill on both toes or all toes. And ask them to push against me again and pull. Push and pull. Go back up here and bilaterally check his radial pulses. Check for rate, rhythm, and something else. Okay. Rate, rhythm. Yeah. I'm going to double check everything. All right. And I have taken a full set of vitals. And I will ask him if he needs anything else right now. If not, I will say I will come back later. Before I do that though, I'm going to quickly do some range of motion while I was at the limbs with him. I would abduct and adduct with both arms and legs if he could. And then flex and extend with all limbs he could. Supinate and pronate. And circumduct where we can. And then is there anything else you needed? Okay, I will come back to check on him later on.